Hello, good day everyone. I'm Brian, I'm from the Department of Surgery. Here is my colleague.
And I'm Jason from the Department of Surgery as well. So today we'll bring you around a tour, familiarize yourself in your early days, in your 4 years as a Master of Surgery candidate. So now we are at level 4 on the Faculty of Medicine. As you can see on my right side, this is the center point. This is where most of us do our work. Undergraduate students, postgraduate students, academic staff do their research, their theses, their studying, or they can even hang out around this area. Now, next up, we're going down to level 3. So now we're at level 3 of the Faculty of Medicine. Behind me is the Medi Cafe. It's where you can take your rest, eat your lunch, eat your tea time, or drink some nice tea. Next, we will move on to the auditorium to see where the TJ Danaraj auditorium is. Now we are at level 3, Faculty of Medicine again, and this is the TJ Danaraj library and also the auditorium. Come on in. So as we walk along this beautiful hallway leading to the front all the way to the end is the auditorium, and then on my right is the TJ Danaraj Medical Library, where you can also spend your time doing your work and also your thesis or research studies around this area. As we head out from the same hallway, we will head down to level 2, where I'll show you where the Secretariat offices are. Okay, now we're at level 2, Faculty of Medicine. Behind me, you can see this is the Department of Surgery. Most of our officers, of our lecturers, professors are here. And also, we have the Secretariat office, which is also situated here. Come on in. So this is the Secretariat office. It's one of the most important places of our 4 years as candidate of Master of Surgery. This is where you do most of your office work, meetings, theses. They're all done over here. Okay, now as we head out, we will head to the clinical auditorium, which is just right opposite the Department of Surgery. Behind me is the clinical auditorium, where you have some of your exams here, where you have your meetings or your gathering of your official duties over here.
So when you walk from the clinical auditorium towards on your right, you will see our ICU here. Here is where we nurse most our critically ill patients will be nursed here. So we have to come and review our patients here. So make sure we get to know where is the ICU. So we walk in from this door and yep. Alright, walking straight from the ICU, on your left, you will see our main OT. This is the Menara Utama OT. So this is a place that we need to get ourselves familiarized with as we are surgeons. So, yep, this is our main OT here. Yeah, and make sure you change your gown before you go in. Right. So from here, with the same lift, we can go up to our wards, which is involving from 6U, 7U, 8U, 9U. So basically, all the floors we have to be familiar with in Menara Utama here. So we can use this lift to go up. Let's go. Alright, so as we reach the 7th floor, this is our ward, 7U. This is our main surgical ward where most of our surgical patients will be admitted to here. Alright, so get familiarized with here and let's go to where we can do our work and rest, 7C. Let's go. Alright, so this is 7C. This is where we can do our work, rest, and yep, sometimes we take our short naps here in between. Yeah, you can take this lift down to the clinics. Alright, so Coming out from the lift, you will head to our left to go to the surgical clinic in our SOPD. So let's go. So you can see here, this is the surgical clinic. So it's where we run our clinics here. We share the clinic, so all the subs will be here. Whatever clinic will be run here. Well, so after we see the clinic, let's go to Menara Selatan, where our endoscopy unit is there, and we will walk through there, and we will go to emergency department, where we take referrals, and we will see our referrals from there. Let's go. Alright, as you can see above me, this is Menara Selatan, walking towards there. So when we come here, this is the admission counter for most of our patients that will be admitted to the ward, especially the elective admissions. Many times we have tight beds, so our patient will be here. So we have to come down here and we have to see them here, and we might need to do some procedures, minor procedures here. So just make sure, just get to know this place well, alright? This is the lift leading up to the Menara Selatan lift, where we leads up to 6th floor. It's the endoscopy unit. Head out towards Menara Selatan, we will go towards the emergency department, where there's a cafe above it, and below it is the emergency department. So let's go and check it out. This is the cafe on my left. Yep, this is where we have our lunch. So from the cafe, we can take this lift. This lift, we can take it down to the ground floor. So where it will be the emergency department straight. I'll show you. Let's go. Okay, so coming out from the lift, on your left, we will head to our first call on-call room. So we will use this room for our on-call as the first caller. Alright, so let's go to ED and see some cases. So here, this is our radiology ROTD. So this is where we request most of our urgent scans, and the CT scans will be done here. So make sure we know this place well to come and request the scans here. So now we will take you to the resus and also the AMC. So this is the resus area where you get referrals from here. So make sure you remember the resus. And in front there is the AMC. It's equivalent to the yellow zone. So in most hospitals. So that's where you can see the yellow zone cases. And where we get green zone cases, let's go over there. So on my right, this is the green zone, where it's the zone tidak critical. And on my left is the ward pemerhatian, where you can observe patients overnight here. Hi, so from here we will go up and we will head to the Women and Children Health Center. Coming up from this lift, we have a link bridge that we can link towards the main building. So now let's head to Menara Timur, where my colleagues will take you to the tour in the Menara Timur. Let's go. So I'll pass over to my colleague to bring you to the tour of the Women and Child Health Complex.
And once again, we would like to welcome you to join our family and also to enjoy your time here in University Malaya Medical Center.
Thank Thank you, Dr. Jason and Dr. Brian. So, hi, my name is Aisha. Today I'll take you through Menara KWKK, where most of our pediatric surgical activities and procedures will all be done here. So, this is the lobby to Menara KWKK. At the lobby, there are a few facilities where you can find refreshments such as fruit and snacks. We have our pastry shops here. And more importantly, we have coffee shops such as the He and She coffee shop here. And my personal favorite, the Gloria Jean's coffee. Okay. So now we will go into our lobby, our lift, where we will go and see our clinics, OT and also our wards. So now we are out of the lift, we are at level 3. So at level 3, we have our pediatric intensive care unit and also our pediatric operation theatre. So that is our pediatric operation theatre. So you have your elective, your emergency surgeries and some pediatric procedures such as bronchoscopy will also be done here. So at the back here is our pediatric ICU. Okay, so now we will go up to our 4th floor, which is where we have our pediatric surgical clinics. Okay, so now we are at the 4th floor. So coming out of this room, you will see our pediatric surgical clinic on your right. So this is our pediatric surgical clinic. So we will have clinics usually on Friday mornings and also on Thursday afternoon after 2 p.m. So now let's go up to our ward, which is at the 6th floor. So now we're at our 6th floor, where you will find home for the next 4 years of your Pediatric Surgical Masters program. So at the 6th floor, you will have the MO room, facilities for your discussions and also for you to put your stuff. And also, if you would like to have a little bit of rest, this is where all your MO rooms will be on this floor. And besides that, we have our surgical ward, the pre-surgery and also post-surgery ward. We also have our daycare, surgical daycare. I'll bring you to it on the left side. So as you can see, this is our pediatric surgical daycare. So we have our urology patients coming in here and also our bowel management patients will also come here for further management and treatment. So at the 6th floor, you will also find your, we call it MO room. So you have a few small rooms such as here and also on this side here. Probably just about one big table with 2, 3, 4 chairs. But if you want a bigger room for discussion, we have what we call a conference room, bilik, or written here, bilik perbincangan 2. So this is where you can have bigger discussions or even teaching sessions with lecturers or even just an academic discussion with your fellow colleagues. So now, this is where we have our pediatric surgical ward. As you can see here, is our ward where patients get admitted before the surgeries, especially the elective cases. And at the back there is where you will see patients will go after surgery or post-op. They will be admitted here. So in our post-op ward, we have HDU, or also known as acute days. And we also have our regular cubicles for our more stable patients. So in 6PA, you will also find the MO on-call room. So this is the place where you try to get a little bit of nap in between cases before you are refreshed for the next day of working. So we've covered most of the important places that you need to know for your 4-year journey in UM. So I will pass the next tour to Dr. Ivana, where she will bring you through Menara Timur and back to the department. So I would just like to wish everyone welcome to UM and I hope you have a great time going through your master's journey with us. Thank you.
So thank you Dr. Aisha for taking them through complex wanita dan kanak-kanak. My name is Dr. Ivana and I will now take you to Menara Timur. Now we're currently at the lobby of Menara Timur and I will take you inside. So the first thing you see here is our pusat setempat pengambilan darah where patients come and get their blood taken. And if you come over this side, we have a Bondi Cafe where we can usually grab our lunch or grab a coffee or some snacks to sustain ourselves. And if we keep going this way, we will enter the Menara Timur building. This is the main part of the building, and this is where the lifts, you can take the lifts to access the other floors of Menara Timur. We're currently on the second floor. If we go slightly past the elevators, you will end up at the UMMC SIGMID. This is where the SIGMID OT is, which is the Center for Image-Guided and Minimally Invasive Therapy. So now we're currently on the fourth floor, and this is where the daycare surgery OT is. So this is where the patients will enter, and I'm going to take you to the entrance to the changing rooms. So as you walk further down the corridor, this is the entrance to the male changing room, and this is the entrance to the female changing room. And now we're going to go down to the third floor. So now we're on the third floor. Coming out of the lift, if we turn to the right, we have our anesthetic clinic. So this is where patients come and get their pre-op anesthetic assessments done. And if you follow me to the other side, this is the examination ward where we have our undergraduate and also postgraduate programs. And if we continue going forward, we'll come all the way to the end, and on the left we have our urology daycare. Now we're back at the elevators, and we shall take the lift down back to the second floor where the lobby is. Now that we're back at the lobby, follow me as I take you through the quickest way to get back to the surgical department. So then eventually you'll come to the end of this hallway, and if you take left and walk through Laluan B, you just keep going and you will end up again at the Department of Surgery. So with that, this concludes the tour around UMMC. Welcome to the UM Surgical family, and I wish you all the best in your postgraduate training. Hope to see you around.